Jennifer Shepard, your integrative manual physical therapist. A story in knee pain and compressive forces. I have a patient I'm working on. He is an amazing athlete, endurance athlete, mostly cycling. Has been had a knee injury, had an actual meniscal tear a handful of years ago. Has gone through several rounds of STEM, I think some PRP as well. Still struggling with some knee pain. So as we dive a little deeper, and he's gone through all the traditional routes of physical therapy, stretching, strengthening, maybe cupping, maybe scraping. Again, a lot of that is external tissue work, which is important. But often we need to go even deeper into internal, like deeper into the container, these deeper fascial layers, these deeper mechanical lines of tension, compression, force, both efficient and inefficient throughout the body. The question we are always asking is why? What's happening here? Why? What's going on? So as I work with him, we very quickly identified compression. And the only way this would absolutely show up on x-ray as well. Like you would be able to see, hey, there's not as much space at this medial joint line on the femur and tibia as the other side. Like if your eye was paying attention to it, you can notice that. But where that is confirmed is with my hands, with our hands. Our hands can feel at the joint line or anywhere, at any joint lines, at any fascial planes, intersections. We can feel where tissue joint has a good, healthy end feel. And what that means is it's got some spring, it's got some give, it's got some ease. It can slide and glide at the right time in any direction that this person is going to go in. And what's happening for him was so much compression. So absolutely I need to get in there and literally decompress that region because he needs some space. So anytime he went into a squat or flexion on his bike, increase compression, increase compression. So no matter how much stem he got to help regenerate, if these forces continue to come in, we're going to continue to be in this vicious circle of compressive forces on the tissues, on the meniscus, irritation, wearing that soft tissue down, coming down into bone on bone eventually. So my job was to unpack where are these forces coming from. So as he went into squat, absolutely I can feel how this femur was coming in to more pressure was going through that femoral shaft down into that medial femoral head. So as we look above and below, yes, old ankle sprains, there's rotational components, there's rotation of that distal tibia. And I'm sorry that I can't show this. Someday I will try to show it with his pictures and videos to show you mechanistically, here's what's going on. So as we started to improve the dorsiflexion, so as he went into dorsiflexion without compensatory rotation at the tibia, creating forces at the medial joint line, we went up to the hip. The biggest place right now is this hip. So if he can't get into internal rotation, adduction, again, we're getting abnormal, inefficient, increased strain forces that were coming diagonal, going right into that medial knee joint. So on and off that bike, and actually the next point is like once we get into the bike, right, we're going closed chain. If you want to know all about bike mechanics, definitely look up my buddy Curtis Cramblett. He is brilliant with regard to mechanics on and off the bike, because once you get on the bike, like we've closed chain that bottom, right? We've locked out the bottom, we've locked out the top. So when we close chain from above and below, there's less opportunity for the body to compensate. So if as the body's going through space, if there's an area that it cannot clear well, it's going to try to find another place. Another place will continue to get jammed and banged into with each pedal stroke. So we've been working on and off the table, on the table, making sure that we've worked into dorsiflexion while we're working hip internal rotation, adduction, inferior glide, decompressing at the knee joint all the time. But again, like I said, if we don't address the forces that are coming into the knee joint, we're just going to continue to be in that vicious cycle. Again, maybe we can keep him out of trouble if he's always coming in to decompress that knee joint, but I really want to identify what are the forces coming in. There was a smidge of a leg length discrepancy, which we addressed and supported. We brought in some orthotics to support that foot ankle position to decrease and improve that tracking of the knee over the foot, again, for optimal flexion extension at that knee joint. And finally, these last couple sessions we've had on the bike, I'm like, I want to feel what's happening while you're on that bike. Absolutely, we need to treat it through that pelvis. We need to treat through the pelvis. pubic bone, ischial tubes, the innominate itself into the hip. So we need to really open up all of those mechanics to create ease, so forces weren't concentrated in one spot. And that's what I told him many times, like, we're talking about millimeters, and my goal is to create a bit more opportunity for variability and wiggle room. He really didn't have any wiggle room because of limitations at the pelvis and the hip, limitations at the ankle, all these forces coming in at the knee. So if we can open up, give him a bit more opportunity for range of motion elsewhere, perhaps we can, and actually we are, decreasing those pressure forces at that medial knee joint. Finally, on that bike, I wanted to feel what exactly is happening, and sure enough, still as he was going through that top of that joint line, I needed to specifically get in there, mobilize that knee joint at that top from like 10 o'clock to 2 o'clock as he was coming through that pedal stroke. So it's exciting because he was at a place of frustration, right? He spent a lot of money on stem, and he still was getting some swelling on occasion when he would go into bigger, deeper squats, right? So here's like end range flexion, what's happening there at the joint that is still irritating. Yes, there's some old pathology, and we were almost to the point where I said, maybe you need to get that looked at a little bit further. Maybe you need to scope, maybe you need to get a little piece cleaned up that we just can't get to, because sometimes we have to do that. And I said, if you do, the great news is we've addressed a lot of these faulty mechanics or inefficient mechanics that were driving these strain forces in the first place. So if you do need to go in there and kind of get things cleaned out, you're going to come out even better because we've addressed the drivers of the problem to begin with. And yes, an injury happened, but when we go back to that injury, what were the inefficient mechanics to begin with that perhaps set him up to be more vulnerable for injury? That's the question I always want to ask. So injuries happen, yes, but are there things that were lurking in the system that made someone a bit more vulnerable? So this is the importance of looking at biomechanics, internal, external. Things are more than just strength and length. Again, how are bones moving? How are joints moving? But not just one joint. We can't just look at his knee joint, which most people are just looking at his knee joint. How so much this hip and this ankle were driving the mechanics of the knee, and even more so, equally, the importance of our hands to be able to feel. Because if your hands can't feel precisely where these forces are occurring, these strain patterns are occurring, you're not going to be able to find it to treat it. And again, if you don't treat it, we're missing these pieces that are driving mechanics. So it comes into precision of our hands, which comes with practice and training and mentorship. So as you continue to work in your clinic, ask those questions, bigger, above and below. What's the big picture through movement, through space, through specific activity? And if you don't have hands, find a mentor. I absolutely recommend diving into the Institute of Physical Art. That's where I learned how to develop my hands. I further refined my hands through the work of the Brawl Institute, so I admire both of those organizations so much. They're the ones who have created me to be the therapist I am. And then find a mentor. I have mentorship here in my clinic in Westlake, Ohio, and we are so excited to help teach and train you so that you can be more effective in the clinic. We can help keep our patients out of surgery. We can save them money, save them time, and keep them out there doing the things that they love to do.